Hello everyone, and welcome back. In today's class, we're going to be discussing the axillary region. We're going to be talking about the definition, the borders, clinical anatomy, and the context. So the axillary region is a pyramidal space that is located in between the thorax and the upper limb. So here is the diagram illustrating the axilla in blue. If you check here, this part labeled blue, this piece labeled blue, which is a pyramid, is the axilla. And from this diagram, I can also see that it is between the upper limb and the thorax. So the axilla has an apex, it has a base, and it has four walls. So here is the apex of the axilla. Here is the apex of the axilla, and here is the base. Then it has four walls. It has an anterior wall, a posterior wall, a medial wall, and a lateral wall. Now, from our knowledge of gross anatomy, the introduction to gross anatomy, said media is closer to the middle of the body, right? Then lateral is further away. They will have the anterior closer to the front, then closer to the back. So you can as well imagine that if this is the apex and this is the base, then you can have an anterior wall, which is the front, right? Then there's a posterior wall at the back. They have a lateral wall further away from the midline. They have a medial wall. So let's discuss about the apex. So just like I said, here is the apex of the axilla, and it is formed by the lateral border of first rib. Here is the first rib. First rib is indicated here. It's also formed by the superior border of the scapula. This is the scapula. Scapula is this bone. It is that triangular bone. It is formed by the lateral border of first rib, by the superior border of scapula, and also by the posterior border of clavicle. So here is the clavicle. So the posterior border of this clavicle is what forms the apex of the axilla. So let's discuss the walls. Say it has four walls, right? It has an anterior wall, a posterior wall, a lateral wall, and a medial wall. So the lateral wall, which is indicated here, is by the intertubercular groove of the humerus. So this is the lateral wall of the axillary region being formed by the intertubercular groove of the humerus. Then the medial wall, this is the medial wall, for reference purposes, is formed by the serratus anterior and the thoracic wall. So here's the thoracic wall. Here the thoracic wall. It also forms the medial wall of the axilla. Then the anterior wall is formed by the pectoralis major muscle. So anteriorly, so if you want to, you can highlight diagrams here. It's formed by the pectoralis major muscle. Then posteriorly, we have a teres major. So posteriorly is formed by the teres major. So essentially, it has an apex, right, which is also known as the cervical axillary canal. It has a base. Then it has four walls: an anterior wall, a posterior wall, a medial wall, and lateral wall. So let's go to the contents of the axilla. And it's very important to know that the axilla serves as a passageway for neurovascular structures and muscles to pass. And as such, we have very important contents of the axilla, and they are listed here. The first one is the axillary artery, and the axillary artery is the main artery of the upper limb, divided into three by the pectoralis minor muscle. There's one medial to it, there's one posterior to it, then there's one lateral to it, and they give branches 1, 2, 3 respectively. But that will be discussed in another class. They also have the axillary vein that gives tributaries to the cephalic and basidic vein, which is the main venous drainage of the upper limb. Also, we have the brachial plexus, we have the axillary lymph nodes, we have the biceps brachii, specifically the short head, and we also have the coracle brachialis. Let us go to discuss the clinical anatomy of the axillary region. Just like we said, it serves as a passageway for important vascular structures to pass, and as such, issues may arise with some of these contents and other structures. So the first one I want to discuss is an injury to the long thoracic nerve that can cause wound scapula, and also an injury may occur to the axillary nerve if there's a damage to the surgical neck of the humerus. And also we also have the axillary lymph node biopsy. So having said that, I hope that you understand the axillary region, and if you have further questions, drop them in the comment section. Don't forget to subscribe and like. Thank you so much.